those who want to improve the health of themselves. This is also for those who want to improve the health of their friends, family members, acquaintances, co-workers, enemies, people of all levels. It is important that we recognize the stream of the time that we are living in, so that we'll take care of the health of ourselves and the health of everybody who is around. Because right now, I'm in a different city, a very different city in the Western region, attending to a funeral of a dead loved one. So you cannot predict. Cardiac arrest is eliminating people many times. So, but you see, it's not just the health. It is the circumstances leading to the health. Because a lot of people take their health for their health because it's expensive. But when they realize that their health is a dangerous thing, they've gotten to a point where the situation is dangerous. When people realize that, it is at that point that a lot of people now are willing to sell their house. They are willing to sell their car. They are willing to sell their belongings in order to take care of the health of themselves, of their family members. At that point in time when the thing has become critical, that is when people are willing. There's a gentleman, I showed him how he can take care of his health. He says, Doc, I don't have money. And when the thing became bloody, I went to the hospital, the doctor said you have to do an emergency surgery, which is going to cost you 54,000 cedis. And he calls me and said, Doc, I need your prescriptions. I said, no, this is not an emergency thing. Okay? Unfortunately, he died 4 days ago. You can't wait for things to get critical. And you don't have to say that, oh, I'm working, I'm living, I'm doing fine, so everything is excellent. Everything is not excellent. Okay? Sometimes you just have to be able to recognize that we are. Abraham Lincoln said it. He said, you die at 25, just that you're not buried yet until you are 75. So ladies and gentlemen, I want to take this opportunity to welcome all of you who's around, all those people who are around in this
recording in progress
virtual health program. I want to say thank you very much indeed for being around here. You've shown that you're a lover of health. Nonetheless, one thing that you may probably do is to give the link to someone. You send the link to a friend, family member, a co-worker, an enemy, somebody. Tell that person that it is important for him to be able to be part of this. Now, can you please see your names? Okay? Because I want to use this microphone to welcome everyone, not just watching the crowd, and you are right there. So can you type your name and where you connect from? Please type your name and where you connect from. Imagine I type your name and where you connect from. You will not be with me. Because this is not only me talking. This is you listening. When you listen to me, I become much more emboldened and be able to release my entire house of Agosa through your auditory. All right, you have a son from Tema, you have said, Coffee from Aprils. You have Johnny Bond, Tema. The rest of you will do the same. And we will get started. We'll get started. I have Dr. Project here. You have Dr. Loresan here. There are a lot of other incredible people who are around. They will be sharing some of the incredible points of health free with us right here. All right. So, ladies and gentlemen, my name is Dr. Sari. I'm a doctor. I'm a professor in the University of Ghana, Lagos. I'm also a visiting professor in Stellenbosch University, South Africa, and Warwick University in the UK. I am a scientist in the area of toxicology as well, so I'm able to give you an advice on how you can take care of yourself against toxins that accumulate. Welcome, Dr. Tettey Doe from the UK, London, specialist psychiatrist. He's also in our midst, who are in a champ from Bismarck from Kumasi, and Mercy from Winnipeg. All right, ladies and gentlemen, it's a pleasure to have all of you here. And it's a pleasure to learn. Knowledge is the only asset that multiplies all other assets. So some of the things you're going to learn here will change the way you perceive health. All right. So the first thing I want to put across is that everybody is sick, just that you don't know yet. Everybody. Every single person is sick, especially between the ages of 20 to 200. That person is sick. Now, the sickness is not a small sickness, it's a big one. It's a big one. And it can cause something we know as cardiac arrest. Cardiac arrest is no respect of anybody. I have seen children, 21, 22. When you go to Google, just type footballers who died, okay, on the field, live footballers who died on the field. You'll be amazed. You'll be amazed. You'll see Wikipedia will list over 12,000 footballers who have died whilst they were playing the football. Whilst they were playing the football. Why? With a footballer who is more athletic, strengthening, agile, acrobatically precocious. Why will a footballer like that just go? Do you remember Vivian Foy, Cameroon and Colombia? They were playing football. The gentleman was on the field. He died. Ericsson, Denmark, Finland were playing the last one. You can come backwards and he collapsed. He was put on invertible defibrillator. He almost died. Several other people have gone through similar things. So take care of your health. But how do you do that? Before you do that, I want to share something with you. There is a part of the human body is all being oxidized. Every single human being is undergoing something known as oxidation. Oxidation is commonly seen among ants and animals, especially among plants and among non-living things. Cut an apple into two, split it open. The apple comes into contact with oxygen. The apple begins to rust. The apple is in contact with oxygen. The process is known as oxidation. The apple is rusting. Do the same thing to yam. Cut it into two. After a few hours, you see that it turns brownish. That is what? Oxidation. So, oxidation. When it comes to metals, let's say blade, you leave some blade down. After some few days, what happens? The blade begins to rust because the blade is in contact with oxygen. But it's strange, oxygen is good for the body. So how come when you come into contact with oxygen, anything that comes into contact with oxygen will rust? Anything that comes into contact with oxygen will rust. Human beings, we don't just come into contact with oxygen, we breathe in the oxygen. We breathe in human beings, we breathe in the oxygen. And as long as you are breathing in the oxygen, what's going to happen? You are rusting. You're rusting. But you see, you don't see the rusting with your naked eye. But over time, the rusting will manifest themselves in diseases. Let me show you something. Yeah, several professors and doctors across the world who have recognized that this rusting leads to multiple diseases in the human body. Now, sometimes we even make the rusting worse by taking in a lot of medicines. As you take in a lot of medicines, the rusting even increases by more. Why? Listen to Professor Peter Doe as he speaks briefly on 18 seconds, the danger of taking constant medication, which increases this rusting process.
My name is Peter Doe. I am a director of the Nordic Conference Center in Copenhagen, a professor of research design and analysis at the University of Copenhagen. 2 years ago, I found out that our prescription drugs are the third leading cause of death after heart disease and cancer. Our drugs kill around 200,000 people.
So our drugs kill around 200,000 people in America every year. How many people do you think they kill in Ghana, in the UK, in Nigeria, in Liberia? If 200,000 people are dying every year in the US, how many do you think? And they are dying because of what? Accumulation of drugs. taking several antihypertensive and anti-diabetic drugs over time destroy the human cells. Oxidation increases by significant mark. Stress has affected 35% of adults everywhere in the world. On Monday morning, the heart attack rate rises by 35%. On Monday morning, people die on a Monday than another day in the week. Why? Because of a buildup of stress. 39% of adults are overweight. And all of these will manifest themselves in heart attack, Alzheimer's, stroke, lung cancer, stress. If somebody says stress is normal, it's not normal. 12.2 million people die of stress every year. No, I mean 12.2 million people die of stress every year. That is more than the population total 3 times. So we need a way to handle that. Now let me share something very briefly. You know, the thing that causes the damage is known as what? Oxidation. Now, oxidation destroys the cells. So we need something that will fight that destruction, that free radicals. And that is known as antioxidant. You see, anti-oxidation is against oxidation. And there are several antioxidants. Some of them are outside the body. So on the screen on my bottom right, the things you see, vitamin E, vitamin C, these are antioxidants. They fight the stress, they fight diseases. Outside, these things you can only get them outside the body. Carotenoids, you can get it outside the body. Alpha-lipoic acid, you can get it outside the body. But you see, the body doesn't do well with things that are outside it, and you're giving it away. The body will do better when the solution is from inside. So let's say you have headache. You will take aspirin to deal with a headache. You take paracetamol to deal with a headache. But then there's a way you can deal with the headache internally. Take a glass of water. The human body is able to regurgitate and then deal with the headache internally. So if you have an internal solution, deal with it. So there are antioxidants that are inside the body. The most powerful of all is glutathione. Because you have albumin, bilirubin, glucose, and other things inside the body. But the most powerful of all is glutathione. Glutathione is a powerful antioxidant in the human body. It strengthens the immune system, reduces inflammation, slows down aging, and supports several other things. Glutathione is currently the only thing that can improve the mental function of the body, the physical libido of the body. Glutathione is inside your body already. It solves the problem already. But why is it that we still get the problem even though glutathione is already inside the body? That is the most significant aspect of what we plan to discuss today. Now, Dr. Gloria Ansa is a specialist doctor in the University of Ghana. Okay? And she has been one of the instrumentalists, in championing the use of glutathione and several other things across the world. Now, what I'm going to do is I'm going to let Dr. Gloria Ansa share some incredible things. But before he comes, I want to share something related to this glutathione. It protects you against HIV. It protects you. Glutathione, which you already have inside you. It allows the body to fight 74 diseases. And I will show you some of the diseases very soon. It allows the body to fight 74 diseases, like obesity. If you have a lot of glutathione inside your body can fight obesity. The body can fight hepatitis, HIV, brain tumor, cancer, every form of cancer, prostate, neuropsychological diseases like migraine, Alzheimer's, Parkinson. If you have a lot of glutathione in your body, so what is that glutathione? It's a little molecule made up of glycine, cysteine, and glutamine. And it's so powerful that it recycles all other antioxidants in the body. And so the more you have it, the greater. But the problem is that as we age, as we grow, especially from age 20, the glutathione level begins to drop. But as you can see on the chart, the glutathione level drops every year by 1.5%. Now remember, the glutathione is the only thing that fights oxidation, but it's dropping, it's dropping, it's dropping, it's dropping every single year. So by the time you are 55 years, you have reduced the glutathione level by almost 45%. So the body is not able, you see, that is why when people are growing, when a person is growing, his ability to fight disease gets weaker and weaker and weaker and weaker because the molecular defenses are going down. A lot of people don't have this knowledge. And so what they do is that they take in more medicines. But the medicines even deplete the glutathione better. Ladies and gentlemen, the more medications you take, the more the glutathione level will drop. And so many doctors, many professional doctors, they recommend you taking less medications. Don't take it, but don't be dependent on medicines. There are some people, they have the medicines in their car boot. Now, why does the glutathione level go down? It goes down because of stress, because of medicines, because of bad food, because of the environment. The mobile phone you are using today produces 41 notches of radioactive isotopes. And you put a mobile phone on your ear, at every maximum of 30 minutes, your brain is containing radioactive isotope. Radiation is entering your mind. It's been predicted that by the year 2055, many people will be having brain tumor because of what? Mobile phone. All of these things deplete the glutathione level. And so this man known as Professor Nagasawa, he's a professor of several years. He has over 100 papers. He's a professor of medicine, medicinal toxicology, immunology, pathology, several specialisms. And this man, together with thousands of doctors, created something that can raise the glutathione level. See, you remember we said that the glutathione level, the glutathione is the only thing that can fight disease, that can fight oxidation, that can fight free radicals. But it's going down. It's going down. And so you need to bring it up. No medicine can bring the glutathione up. No medicine. And I want to repeat this. A lot of people don't know. Many medical doctors agree with this. No medication can raise the level of glutathione level except ribosine. Ribosine is the only revolutionary compound. After 25 years of research, ribosine was born. It was born into the world of the United States in 2007. And ribosine currently is the only thing which when it takes allows the body to produce a lot of the molecular glutathione levels. It is a plant-based thing. It is not medicine. It is not a drug. It is not designed to cure any particular disease. What it does rather is to allow your body to produce its own medicine. And when that happens, the body can fight major health problems. It's been endorsed. The FDA across the world, US, Ghana, Nigeria, Australia, Canada, has endorsed it. There are several articles. Tens and hundreds of articles have been written to support the power of this virus. Now, for those of you who know that COVID-19 has taken the minds of the world, COVID-19 has been found to go down in the body of people who have raised their glutathione levels. And we know that we only raise the glutathione level by 300%, more than the next best alternative. And that next best alternative is known as N-acetylcysteine, which was engineered by the same group of professors. Ladies and gentlemen, it is my singular honor to introduce all of us who know and those who don't know that ribosine is powerful. I'm now going to introduce Dr. Lawrence. He's going to share the connection between glutathione and hypertension and how if you are able to raise your glutathione level, your hypertension level is highly connected. Dr. Lawrence, please, are you there?
Yes, I'm here, Doc.
Okay, so ladies and gentlemen, it's my honor to introduce Dr. Lawrence. He's a specialist doctor in the University of Ghana, and he will take us through briefly the connection between hypertension and glutathione. So we are all ears.
All right. Thank you very much, Doc, and good evening to all our listeners. It's a pleasure to have you all here. And like Dr. Ansari said earlier on, we have heard a lot of things about glutathione and oxidation and oxidative stress, you know. And like he said, as for oxygen, that's why we breathe in oxygen. We need the oxygen. We need the oxygen in our body to facilitate a lot of reactions that go in our body, go on in our body, so that the normal reaction, the energies that we need, the things that we do, so that the organs of the body can function well. So we cannot do without oxygen. But when the oxygen goes in and the processes take place, then some of the oxygen end up on their own and become radicals, free radicals that cause damage. You know, so that is where the oxidative stress comes from. And the oxidative stress is when there's too much of those oxygen species, which we call the reactive oxygen species in the blood. You know, and what glutathione does and all the other antioxidants they do is to pick up these ROS, which sorry, I think my line dropped. The more glutathione you have, the more your body is able to deal with the excess oxygen species or the free radical that cause the disease. And there's a lot of literature that suggests that when you have excessive production of these ROS, they contribute to hypertension, you know, because of the way they affect the brain, the way they affect the vessels, the blood vessels, and then the way they also affect the kidneys, you know. And so all these, whatever the oxygen species do, whatever the free radicals do in the brain, they initiate certain reactions. And these reactions have been found to be related to hypertension. So that where there's excessive oxidative stress, there's also a hypertension. For people who already have hypertension, it becomes more difficult to control. And for people who don't have, then it goes up. And one of the key causes of hypertension, one of the things that we relate to hypertension is aging. You know, that as you age, a lot of people just, for no reason, they get hypertension. And one of the reasons is related to the fact that the glutathione levels are going down, and therefore the activity of the free radicals goes up. Stress is the other one. You know, a lot of stress causes hypertension. You know, so these are things that, and then the other thing is, we say infection also causes the glutathione levels to go down, because one, the body is fighting the infection. The body uses up the glutathione a lot more, you know, and then the process of all that, dealing with that excess free radicals also facilitates the problem of, or aggravates the problem of hypertension. So these are things that we should really be aware of and know how to protect ourselves, because like Dr. Sari said from the beginning, you don't wait till the problem is there that you want emergency solutions. It is always better you have the knowledge and then you deal with them. So key point is that oxidative stress is considered a major mechanism in hypertension. So how do you reduce oxidative stress? Have a lot of glutathione. So if there's an opportunity to improve your glutathione level, please go for it. And then the formation of these reactive oxygen species contribute to the dysfunction of the vessel, that's the vasculature, the kidneys, and in the brain. Those are the things that work together, and we talk about cardiovascular diseases and all that, which is one of the top problems globally, you know. And we also, the last point is that the inflammation that happens with the infection, also the body's reaction to fight them can cause hypertension. So these are things we want to get ourselves aware of, because once you have the knowledge, then you can use it, change your lifestyle, take certain decisions, and invest in your health and make sure that you are healthy. You know, this picture just depicts how the reactions of the reactive oxidative species, that is the free radicals, once you are fighting infections, the impact on the brain, the impact on the blood vessels, the impact on the kidneys, and how they also work together to aggravate the problem of hypertension. So it is said that a word to the wise is enough. So this one, we just want to make people aware that there are options that you can do. There are decisions you can take now to improve your health and make sure you live a healthy life. There are a lot of things we don't have control over when it comes to our health, but the thing that we have control over, please let's take advantage and make sure that we do that. So the glutathione-regulated antioxidants, let us make sure that we strengthen that in our body to also strengthen the body, put the body in the position to protect itself from all the possible diseases. Doc mentioned HIV and COVID. Those are viral illnesses. When it comes to viral illnesses, the body falls mostly on the immune system. So once your immune system is strong, and the immune system is made up mainly of the glutathione and other antioxidants to pick up all these things. So that is how the glutathione helps you to build up your immune system, boost your immune system, and fight these viral illnesses. And we have testimonies of how the glutathione has helped people. The Riboceine has helped people go through these things, improve the outcomes when it comes to HIV and COVID. Thank you very much, Doc. Over to you. Thank you.
Thank you very much indeed, Dr. Dolores. And you do justice to this, because she has been one of the instrumentalists when it comes to several infectious diseases across this country. This lady has done a lot of great work, not only in the University of Ghana, but across the country. She's a specialist, a very powerful specialist when it comes to all kinds of health challenges, and even including infectious diseases. So when you are getting that kind of knowledge from people like this, then you know that you are gaining a lot. So ladies and gentlemen, currently the only thing that is helping a lot of people to raise their level of glutathione is the Riboceine technology. Riboceine technology. And we've indicated it took 25 years for this to happen. And today, I am privileged to be one of those in the organizations across the world, together with several other people, some of them are on this screen, who are using the Riboceine to augment the level of glutathione in their body. The first person I gave the Riboceine to was my mother. Both parents are about 80 years old. My mother and father had hypertension and diabetes. These have been with them for over 21 years. They were taking all kinds of medication, about 6 medicines, to be able to control that. I decided to give them this Riboceine. And the Riboceine job was not to cure the hypertension. No, it was not to cure the diabetes. No, it was simply to raise the level of the glutathione. Remember, I told you that it starts going down from age 20. So imagine somebody is 81. By the time the person is 81, much of the molecular glutathione levels have gone down. And so when I gave them the Riboceine, it started raising the glutathione level significantly. By 93 days, they had to go for a checkup. And then a doctor in Sacramento called me and told me that, Doc, I think your mother's diabetes isn't being found. And what I want to do is to do another check in 3 months to see. Did it in 3 months, and then 6 months, and then a year later, that 16 years of diabetes wasn't found anymore. Now, of course, there may be other factors involved, but her molecules went up significantly. Today, she's a diabetes-free lady. My father, the same thing, had hypertension. So guys, the most important thing is to hear from some of our people who have used the Riboceine and have benefited from it. So let me just give the first chance to anybody, please, if you have used this thing, this product, let us hear from ourselves, know the importance of this, so that we have the audacity of dead cockroach to tell other people that this thing is good. So let's listen to anybody who has used it before so that the person can share his testimony or his story. Okay, Sefako, are you there? You told me that you have something to share. If you can unmute yourself, you can share your story with us. Sefako?
Yes, sir. I'm around.
Okay, please go ahead.
Okay, all right. Good evening, everybody. My name is Sefako, actually. All right, I was introduced to Riboceine. That was somewhere last year. I was a little skeptical. I was not too sure because I had a condition, sorry. I had this cold, and it was that serious. It was very severe to the extent that when I had to go out, I had to pack my bag with lots of handkerchiefs before going out. I couldn't stand scents, strong perfumes, particles, powder, all sorts of things. So I was extra careful whenever I was out. But when I started taking the product, I realized that in the first few days, I didn't react to these substances anymore. I didn't even notice it. I didn't realize it. So a week after, I realized that people can spray around me, but I wouldn't sneeze. I will not react badly to it. So I continued taking it. And to date, I don't react. I don't have that severe or serious common cold again. And again, whenever I took granules, I love granules a lot. So whenever I took granules, I realized that my eyes always itched. I could itch and scratch or rub my eyes severally. But I realized that after being on this product, I can take as much granite as I want, but I will not react to it anymore. We thank God for this amazing product. I recommend it to everybody. Let's all try it. Whatever situation you are in, whatever issue that is worrying you, give a try to it. And you also have marvelous testimonies. Thank you so much. Back to you, Prof.
Wonderful, wonderful. Thank you. Thank you. Thank you so much, Loretta, for this wonderful testimony. Now let me go to Dr. Prosper Tettey Doe. Doc, are you there?
Yeah, I'm here, Prof. I'm here, Prof. Can you hear me? I'm here. Can you hear me, Prof? Can you hear me? Oh, network. I'm frozen. Hello? Hello, Prof. Can you hear me? Hello, Prof. Can you